We're going to be having a conversation round about some of the issues around HIV domestic funding and the numbers. Emily Mukomunene is here, and I will say finally, she joins us this morning for us to have a conversation just around this. Emily, good morning.
Good morning to you. How are you?
I am well.
Yes, I'm well too.
Did you get lost?
Not really. I'm not very new in the Standard Group premises.
Okay. Did somebody hijack you?
Well, it's a long story in Nairobi. And being a frontline runner, anything can happen at night between the time you are planning to be somewhere and then an emergency can come up. I'm a frontline runner as a caregiver and also patient support system, but as an anesthetic actor.
Okay.
Yes.
All right.
Yes.
Well, thank you for being here this morning and for us to, in the time that we have, to then be able to look into this matter. But before you do, Dennis will welcome you with today's proverb. We'd love to get your interpretation of it.
Yes, the proverb comes from western part of the continent, West Africa, and it says, a fool has to say something, a wise person has something to say.
A fool has to say something.
A wise person has something to say. How would you interpret that?
Well, it means a wise person says what needs to be said. Or what has value at the right time. But a foolish person would just speak for the sake of speaking or just because there's space to alter something.
Well, what can do?
Something to utter.
Yes.
Just because you can.
Just because you can. Just because you have vocal cords. Just
You want to practice with them.
Yes.
You want to strum the chords.
Yeah.
And maybe what we're hearing is not a nice lullaby.
Well, according to my understanding,
Yes.
that is how I
Well interpreted. Well interpreted.
Fantastic.
Yes.
Interpretation works. All right. We celebrated or commemorated World AIDS Day on the 1st of December. And this comes after decades of having to fight with the infections of HIV, which at some point leads to AIDS, but has been managed for the longest time with, world breaking technologies and also research that then has allowed human beings who have been infected with the virus to then live. A lot of that for the developing world has been funded by the developed world.
Yes.
And so HIV financing, or rather HIV treatment and quality care financing, fortunately and unfortunately, has been handled by those who have the lowest rate of infections for and supporting those countries that have the highest rate of infections. We're looking at a totally different time now where a lot of that funding has been pulled. PEPFAR, which of course is under the United States Development Agency, pulled a lot of that funding.
Yes.
And that was under a directive from the US.
Yes.
We talk about it as though we understand just how detrimental that was to the lives of those who need it for support. But maybe we just don't understand what happens when somebody who is living with HIV doesn't get their medication. What does that mean?
It is worse than even a baby missing the mother's milk. Because when a baby misses the mother's milk, they can always be able to find something else to take. But as for HIV and the drugs, the life-sustaining drugs, as we call them, or life-prolonging drugs, if a client misses the drugs, they have no alternative, they have no choice. Because here it's not a question of where you'll say, if I don't get a Panadol, I can be able to go and get a paracetamol. And the drugs are very expensive. So even if they are available in the market, most of our clients or patients will not be able to afford the drugs. So actually right now we can say the lives of those living positive is under siege. Well, to a certain extent, I try to choose, borrowing from what you said, those who have a low rate of infections. That's the foreign governments have been funding us where our rates of infections are very high. And it's like, I've come to a room here. So I find you've littered. And maybe where I've come from, I've put my house in order. But you want me to go and buy a broom to sweep for you.
Yes.
To keep your place clean. And when we say the rates of new infections are high, it means we keep on littering, and because we have somebody who will always clean it for us. Now, our cleaners, that is the foreign fund, have gone on strike, or they are pulled away. They have said, we shall no longer clean for you. Because what is their benefit when they give us the HIV funding or the health fund? What does American gain from it? Remember, HIV fund, HIV and even diseases like cancer, which were being funded, or even malaria, they do not affect the foreign donors in any way. It's not like the case where we had the COVID-19 or tuberculosis, which are respiratory infections and can affect even the tourists coming to our country.
Right.
But for HIV, it is our own problem. It is our own challenge, and we have to find our own local solutions within us. So we have to take it from that point, say this is our challenge, and we have to sort it ourselves, and we cannot even sue the American government or even the France government, who have also said they are pulling out or reducing what they are giving to the Global Fund for pulling out, because they don't owe us.
So,
our health is supposed to be our responsibility.
Right.
Yes.
So, Emily, health ought to be our responsibility. Foreign governments, rightfully so, they chose to either help us or not. They have pulled out. But are we seeing movement internally to bridge that gap?
It's a tall order. It's a tall order. First of all, I sympathize with those who are beneficiaries of the medication, because most of them were not aware that they were being funded by the donors. All they knew that there was organizations like PEPFAR, CDC, USAID, and would go to the clinic and you'll be told on this day, come for your medication. And then you have people following you to remind you even to take your medication. But little did they know where the money was coming from for that. Very few people are aware of that. So now when they are being told they cannot be able to access that life-saving medication, then they are wondering, what is this? It's a shock to most of them. Those who are aware is maybe the government ministries and the NGOs who were the conduits of ensuring that the medication was available. So, sustainability of providing this life-saving medication at the moment, it is still, I can say we are still in turmoil. It will take time for us to get a proper strategy on how we can do it. And remember, not that we cannot manufacture the ARVs locally. But you see, if there's somebody to do for you, then why do you think outside?
So we become lazy.
We become lazy because Kemri would have, it's there for that purpose.
Okay.
Why do we have the CDC, although it's American funded, but we have the branch in Kenya?
There's an HQ, there's an Africa CDC.
Yes.
Right?
Yes.
So let me ask this question. You said ARVs are available in Kenya. It's not a problem of that they're not available. They are available in Kenya.
Yes.
That if you needed them, you would then be able to go in to get a doctor's note, go pick up ARVs for a month. The problem is that they are expensive.
Yes.
And that they may not be readily available to the population of folks who needs them.
Yes.
How much money, what's the going rate essentially for a month's worth of ARVs?
Maybe you're talking about maybe 20,000 to get it proper and supplement, although I'm not very sure about the statistics.
So we're looking at
the information, but that's what I would roughly estimate. And do you know why I'm not even able to give the information? Because these are drugs that you've been getting for free. So nobody has bothered to know, or it has not been our interest to find out the cost of the medication, of the ARVs.
Okay.
Yeah.
So if we're looking about 20,000 shillings, give or take, for this is medication, of course, that is taken every day.
Yes.
And what it does is that it keeps the viral load of the HIV at bay, essentially. So it's not. It's keeping it down. It's suppressing the virus, right? So that's what you do essentially. So it doesn't now come and manifest in other ways. All of this that has been taken care of for free. So that meant folks were going to a particular facility on the treatment, getting the medication and going, not paying a cent.
Not paying a cent for it.
Have we seen that with the withdrawal of this funding, that there's some people who would ordinarily go in who have then not been able to get their treatment?
There are many people are not getting the treatment. And then, remember also we have some supply which is in stock, but with the stop to work order, most of the health providers, the champions who used to be the ones to take the medication to the patients or clients, are not funded now to take. Like if you have to go 10 kilometers, maybe to pick the medication and take it to a particular facility for the clients to access. These health workers are being laid off. So even the medication which is in stock may not be able to reach the beneficiaries before it expires. Yeah. So we have a lot of people, and then others out of shock that maybe after so many months they will not be able to access the free medication. Even the little they had, they're already giving up, not bothered with it at all, because they're saying, when should I take when tomorrow is I'm not sure of tomorrow. Yeah.
So we look at the situation where even the stats that we got, it was this month, right? The stats that we got this month just is an indicator of perhaps before the United States pulled out of this funding. So are we staring then at a situation that perhaps is worse than what we know? And if that's the situation, Ministry of Health, in terms of moving in then to have discussion with these individuals, because if you talk about 20,000 a month, we're talking about almost $250,000 a year for you to just sustain yourself for an entire year. Are we having these discussions on how we plug that? Because President William Ruto is in the United States today to have discussions on health. Is this, maybe if you have information, part of the discussions that will be there? But even while at that, are we approaching possibilities of being a manufacturing hub to be able to take care of our sick, if you have the information?
I may not have the information, although the president might be discussing about health, but I don't know if that discussion will yield to having health financing, international health financing back in place. But all the same, I don't know also whether the Ministry of Health or even the CSOs and NGOs are out there now to dialogue with the clients, because it's still like going to people who are hungry and to tell them, can we talk? It shall be well. Keep on breathing, and eventually maybe we'll be able to get the food. In a situation where they know very well the food might not be forthcoming. Remember, the health matters. Even before the donor funding was cut, we were talking about domestic health financing. And even that domestic health financing is not sustainable if we do not talk on prevention measures.
Are we not talking about prevention? I remember, we're much younger then, but I remember when this whole thing of HIV and then AIDS came up, and the messaging was very clear that this is what will happen to you if you don't do this. And that's how we had the famous ABCs of HIV, right? Yes. So the prevention then saw a drop in the cases or the rate of infection over the years, because the first time it hit, we had, of course, the pictures of entire villages, towns being swept out. Yes. We had grandparents taking care of babies, because that entire generation had been wiped out by HIV, with the cause of sexual transmission being the highest in terms of percentages. So then it became very clear in the minds of people that, okay, wait a minute, if I don't protect myself, the chances of me getting HIV then are very high. As a result, we saw a drop in the rates of infection. So the message hit home. As grotesque as some of those images were, it did something in the minds of people. But now we are back there, it seems, or am I wrong? Whereby we are saying to people again that we need to be talking about prevention. Because this is not a wash your hands kind of thing.
Remember,
it's different.
During those days when we were talking about prevention, ARVs were not there.
Right.
There was no alternative. Is you get AIDS, and we knew the ultimate, it was a death warrant at the time. I'm sorry to say that. But that is how it was during the early days. last week I met a girl we were launching a program somewhere. And she came to me and she told me, I remember you came to our high school. And when you came there, when we were teaching us about HIV and prevention, I thank God because I was a beneficiary. We actually did what we were saying, zip up and abstain. You know, those things like, if you can't, zip it up. Nita chill, you know, those kind of things. The messages were there. Now, the messages are not there now. And if they are there, we only hear them during the commemoration of the World AIDS Day. That was postponed by the Americans in their country or with their funding. Then, with the new HIV infections being rated highest among adolescents and the youth. And you are saying in school, that's where the messages, or in the youth, or in the villages, those things were spoken. Why is it now that we have, if this data is true, 41% new HIV infections within the youth who
because
are in schools?
So aren't we seeing that because ARVs, essentially, what they would do is they suppress the virus.
Yes.
So you're healthy. You look healthy. You're operating properly. Nobody's going to imagine. So that also plays in the minds of people, doesn't it? Because you can say, okay, fine. We also have people who are taking the prophylaxis after having engaged in sexual activity with people they don't even know who they are. So they take this prophylaxis, hoping that it'll take care of any possible infections. We have people sharing prophylaxis.
Yes.
I have one, you have one, we've shared my dose, kind of some absolute, almost grotesque holy communion of this prophylaxis that's going on. But more interestingly, you talk about why don't we have prevention? Please help us understand. Because if you look at statistics that we've come across, and we share this all the time, that between Friday evening and Monday morning in Kenya, in pharmacies and medical facilities, the highest percentage of medication that is purchased by young people, these adolescents that you're talking about, is emergency contraception. It's not condoms.
No, it's not condoms.
It is emergency contraception. So what does that tell you? This prevention is not in the minds of people anymore. We are more afraid of getting pregnant than we are of getting a sexually transmitted infection.
Language. That's the language they're saying. I would rather protect myself from getting pregnant than I don't care about HIV. In fact, they think most of them are thinking it's just a story because the medication is there and the medication was free if you get there. But now, this time, we cannot be quiet anymore because we'll be overwhelmed. In absence of the life-sustaining medication being available for free and us rolling out new HIV cases daily, this is a collapsing health system.
Because it wasn't adolescents that were being affected at this rate before. We just talked about there was a generation that disappeared where we had grandparents taking care of. There are many, many stories of adults today who were raised by their grandparents in areas that were high infection rates of HIV. Today, adolescents, 13 to 18-year-olds being infected with HIV by 41% is ridiculously high.
And remember, this is not mother-to-child transmission. No, this is contact. And contact through sex for that age group. And we cannot tell them, you cannot go and meet your fantasies because that's the time when they're really ready for it. So what do we do? Talk about abstinence or talk about protection? We have to really break the silence on this, go out of our way, start visiting the institutions, but who will fund, have class readers that are talking about health and prevention of HIV and other lifestyle diseases. Like that girl was saying, she read a book that we were marketing in one of the schools. And the book gave them the message that really made most of them not really scared. But they were scared, but the fear made them cautious.
You see, when you talk about the generation that got this message at the time, one would say that over time, these messages just stopped. So you find the current young people and the Gen Zs of right now pretty much have never come across anyone talk to them about HIV and the risks that do exist. So you find there is that information gap that does exist, And with that then, also with the fact that perhaps information that is there is they know I will take an e-pill because I don't want to get pregnant, right?
Yeah.
Yes.
But no one is is pounding information on there is also HIV AIDS, that once you get it is a lifetime disease that you have to deal with. That information is lacking.
Is lacking.
That together with the fact that I know I can take prophylaxis, that I can deal with that. Therefore, people have generally just become lazy and do not care about HIV because we have ARVs and prophylaxis. So at the end of the day, my biggest problem is fearing to get pregnant.
Yes.
But now we don't have those ARVs.
Yes.
Yeah, but that's where we need to be as media houses, as health advocates, as people in the health space. I don't know how we are going to get the funding to do awareness, because at the end of it, everything is about funding. Otherwise, what we are calling universal healthcare will not be sustainable if we are not doing awareness, if we are not teaching prevention, and not just to the adolescents. I would say right from grade 3, 7, 8 years, we should start the conversation. We cannot say they are too young to hear. No, with the social media, there is nothing, there is a taboo.
Oh, no, I
For
mean,
them to know.
doctors tell us that
There is nothing.
the minute a
That's
child can tell that there's a difference between them and if they're female, them and a male, then it's not too early to start having these conversations
Yes.
with them. Is it too active or too serious of a conversation to seriously be talking about prevention on the scale that it was done in the 1990s, whereby this prevention thing, some people had to even change the language that they used during these campaigns because it was not politically correct or all of this, but it was an intensive campaign. But it stuck like I said, it stuck in the minds of people. Are we going back there, Emily?
We have to go back. I remember there was a gentleman who sang a song, Usinione ni menana, ukadhani ni kopo.
Yeah, I remember.
Usinione. You know that song? It had Pengine ni napita. There's a song like that, but he was trying to pass a message on prevention and also not judging me by the way I look. Okay, the issues of stigma came by, but even if we talk to the people who are living positive, there are people who really care for, like the adults, they care for their children. They will not like their children to go through what they go through, because even with the ARVs, they still have a lot of side effects. So it's not anything that you would wish somebody else, somebody you love, somebody you care to go through. So I would just call on parents. I would call on stakeholders. I would call on the media. We have to put our heads together and not just wait and say serikali tusaidie. Because the minute you are saying serikali tusaidie, when something has happened in your family, at the end of it, Kenyatta Hospital, Ministry of Health, Minister for Health, even the county government will not be there to go through the psychological, emotional suffering and even the social stigma that you have to go through. Because at this rate, if we cannot access ARVs and the situation gets back to where we see those, the images we used to see before, then that means we shall not even control stigma.
Emily, we've talked about discussing HIV. This message needs to get there. And for a very long time, we've toyed around with the idea of having sex education in our school curriculum at a very young age. There are those who are for it, there are those who are saying it is not proper to introduce our children into these conversations. But like we've said, Ndu, the moment a child is able to differentiate between a boy and a child,
girl.
it is the right time to have this discussion. Is it about time that we just saw we are unable to afford ARVs as a country, as an individual. It's even difficult to do that. And perhaps let's go full throttle, have this discussion at an early age, because prevention is better than cure.
And they're having sex anyway.
And there is no cure, by the way.
Truth.
Yeah.
They are saying, I was talking to a colleague yesterday, and he was saying that in the rural areas, maybe in the urban areas, we are talking about social media influence. But I was saying in the rural areas, you are there, and the goats they are doing it. So how will you tell that child? For how long will you tell that child they are fighting? Are you getting me? So even at that early age, they are able to see what is happening. Much as the urban, we are being influenced by the social media. So the hypocrisy, how we're putting a curtain, a transparent curtain, pretending that we are protecting ourselves, it shall not work. That game of postponing what should be done today should be over, because this conversation should have started the minute Trump said in January, we are cutting health funding. We should have started that conversation. What shall we do with our children? And the advantage we have is that this generation we are talking about, they're in primary schools, they're in secondary schools, they are in the universities. If we engaged and we formed peer-to-peer health clubs in schools and train those who are the peer educators, and then we stock the school libraries with health education materials, that when they meet, even at parade, they can read a chapter, communicate and discuss, then it shall be able to open and enable them to make informed choices in life. Because the echo of what you hear, the echo of what you read, even in the absence of the person who was speaking to you, it will ring a bell. Then you will say, really? Do I want to take this knife that will cut me? And I was told that this knife, even if I try to hold it properly, unless I seal it completely, it will hurt me. Someone will think twice. So the conversation must begin now.
Okay.
Yeah.
So, I mean, with often says that with technology, with development, with many things, our eyes will open. So hadn't we, maybe we shouldn't be so surprised that, you know, there's a lot more exploration and curiosity now, because there's a lot more information. We are, after all, living in the information age.
Yes.
And that we should have expected that this would happen, and that we should have been prepared for it, and that not just, you know, waited for something else. And I'm talking about the increased infections that we see amongst younger people. That there's a curiosity, there is an exploration that's taking place. We should have expected that. So maybe on some point, all stakeholders together in concert drop the ball.
Yes.
Because we just imagined that, you know, well, we've got the infections down, everybody's okay.
Yeah.
Forgetting that there are people who are coming up the chain.
Yes, there are people who are coming up. And we also knew that all along we have the medication. So it does not matter. Somebody will provide the medication. So, but now without the medication, that's what I want to emphasize. Without the donor funding, what are we going to do about health funding? What are we going to do about developing our own ARVs, the life-saving medication? And then it has also taken so long to come up even with an HIV vaccine. Yeah, which I believe, you know, here in Kenya and Africa, we have very bright brains.
Yeah.
We
Absolutely.
have even the natural medicine.
True.
We have people who are able to experiment with the herbs and what the nature has to offer us. We should have been able to come up with HIV prevention medicine, or even treatment. Treatment now, leave alone the life-sustaining medicine. Even the actual treatment that can be able to flush out the virus completely from the system and restore it to its original form.
Yeah.
Yeah.
And for real, we shouldn't be having these conversations just 2 days before and 2 days after December 1st every year.
No.
There should be a daily conversation in terms of what we need to do. No life should be lost uncompromised because of something that can be prevented.
It is very true.
That's for sure.
Yeah.
And so it's our hope that this conversation goes beyond the 1st of December and that it's an everyday conversation until it can be wiped out. We've seen things been wiped out before. This can actually be done as well. Thank you for the work that you do, and also that we can have this conversation with you. And it's our hope that as we work together, we see these, we can go to zero. We can actually go to zero.
I want to invite you. I've started I told you I'm a health advocate,
Yeah.
non-state actor. So last year, I started a campaign to form the health clubs in schools and actually have the go-ahead from the Ministry of Education. Fortunately, or unfortunately, in 2020, I wrote a book on HIV, TB, and COVID-19, which is approved by Ministry of Health and Ministry of Education. And I've been urging people, can we use it so that we educate, we carry out the health education
For our children.
in schools?
Yeah.
You know, the health education in schools, simplified, and they can be able to use it. So I started the campaign this year where I want every school library to get 20 copies of the books, the alumni of the schools and wherever. It is not for me, for my benefit.
Yeah.
It is for the benefit of the nation.
Yeah.
Because tomorrow, maybe your son 5 or 10 years from now, he might want to come and quote my granddaughter. So that information really matters to me. When we safeguard other people's children or the generations, we are safeguarding our collective future.
Indeed.
And saving the world and removing the shame from Africa that we cannot
Take care of
clean ourselves.
Right.
We have to wait for
somebody else to come
for
and
the
do
foreigners
it.
to come and clean us. Let's learn to clean after ourselves.
Good message to end on. Emily Mukomunene is a health rights and advocacy champion. Has been here. What a great message to then be able to end on. Thank you so much for joining us in the Situation Room this morning. And everybody, thank you for being here this Thursday.
This is the Situation Room, the only way to start your day.